Welcome to my channel Brainies. In today's video, I'm going to talk about the muscles of the pectoral region. The muscles of the pectoral region are the pectoralis major, the pectoralis minor, subclavius, and the serratus anterior also. Let us just see the origin, insertion, nerve supply, and function or action of the following muscles. The first one is the pectoralis major. It consists of two heads, the clavicular head and the sternocostal head. The clavicular head, it arises from the anterior surface of medial half of the clavicle. This is a picture depicting the pectoralis major muscle. So you could see the arises from the clavicle. And the sternocostal head, it is the largest of the two heads. It arises from the manubrium and the body of the sternum, and also from the anterior surface of the superior 6 costal cartilages. You could see it in this diagram, the manubrium, sternum, and the 6 costal cartilages. And it gets inserted into the crest of the greater tubercle of humerus. The nerve supply is the clavicular head of the pectoralis major. It derives its nerve supply from the lateral pectoral nerve, which arises from the lateral cord of brachial plexus, and the medial pectoral nerve, it innervates the sternocostal head of pectoralis major. The medial pectoral nerve arises from the medial cord of the brachial plexus. So this is the diagram depicting the pectoralis major, minor, and the subclavius. So the action of pectoralis major. Pectoralis major is one of the important muscle. It adducts, medially rotates, and transversely adducts the arm at the level of the glenohumeral joint, which is the shoulder joint. And it assists in the flexion of the arm, extension of the arm, depresses the shoulder girdle at the level of acromioclavicular and sternoclavicular joints. It also assists in elevating the thorax, especially in case of forced inspiration, and it is a necessary muscle of inspiration also. During the crutch walking or the parallel ball training to the patient, it will assist in supporting the body weight. So next comes the muscle pectoralis minor. This is a muscle of the anterior chest wall. I would have showed you in the diagram. It lies beneath the pectoralis major and contributes to the anterior wall of axilla. So it arises from the 3rd to 5th ribs and gets inserted into the coracoid process of the scapula. The nerve supply of this pectoralis minor is the medial pectoral nerve, which arises from the medial cord of the brachial plexus. The next is the action. It stabilizes the scapula by drawing it inside, that is the antero-inferiorly, against the thoracic wall. Next comes the muscle subclavius. It is a muscle of the anterior chest wall and it's a small muscle also. It is located underneath the clavicle. It arises from the junction of the first rib and the costal cartilage, and it is inserted into the inferior surface of the middle 1/3 of the clavicle. The nerve supply is the nerve to subclavius. The action of the muscle is it depresses the clavicle. The next muscle is the serratus anterior. It is a muscle of the anterior chest wall and it forms the medial border of the axilla region. Actually speaking, the muscle consists of several strips, nearly 8 strips, which arises from the outer border of the ribs through 8 digitations. These 8 digitations, they get attached to the costal surface of the medial border of the scapula. The nerve supply of this serratus anterior is, it is also called as nerve to serratus anterior and also termed as long thoracic nerve of Bell. The action of this particular muscle serratus anterior is rotates the scapula and it allows the arm to be raised beyond 90 degrees. It also protracts the scapula and holding it against the rib cage. Paralysis of this particular serratus anterior muscle can lead to winging of scapula. So this is the picture depicting the serratus anterior. That's it for today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.